Okay, so I would like to start our first session, Technological Developments and Implications, with our first speaker, Dr. Krey. He is CEO of Emperra Digital Diabetes Care, and what he does and why he's here, he will explain now himself. Good to have you here.
Thank you for the introduction. Sehr geehrter Botschafter, ladies and gentlemen,
We just wait for the microphone.
I'm very happy to be here. When I heard that our counterparts are in Toronto, two things came on my mind. One thing is, I visited Toronto 15 years ago, and I bought my children a t-shirt. And on the t-shirt were the writings, I thought my daddy was tall until I saw the CN Tower. But the second thing, and this is the introduction in our part, diabetes care, is that in the early 1920s, two people developed insulin in Toronto. It was Bunting and Best. And until then, this was the start into modern diabetes technology. So I'm very happy to find the link to what we do today. I have a little agenda about diabetes care, about the solution that we have, about the results of an insurance-sponsored trial, about patients' outcomes, and of course about what we are doing today. Diabetes today worldwide are about 387 million people living with diabetes, which is a huge number. But this number will explode to nearly 600 million people living with diabetes in the year 2035. This is one number. A sad number is that every 7 seconds, someone is dying due to diabetes. And this is something where we have to act. The problem is that all the diabetes therapy is based on data. And this data is collected by the patient himself. And this data ends up in a manual diary. And this manual diary looks like that one. This is from a real patient. And the numbers you can or maybe cannot see are hardly readable, surely not complete, and sometimes these numbers are even wrong. So we do not wonder that about 40 to 60% of all people with diabetes do not reach their individual targets because the therapy is based on a bad quality of data. Having said that, last year we spent every $9th for diabetes therapy, for the therapy of secondary complications, and that was $613 billion. And we don't have enough money to afford, or we cannot afford that. So our solution is come back to the problem, come back to the manual diary. When you talk about diabetes therapy is one goal, reduce glucose levels and reduce the variability of glucose levels. So this is the target. And to reduce hypoglycemia and to reduce hypoglycemia. So you're always in the middle, not going too low, not going high low. The market need is very clear. The physicians, being a specialist or being a generalist, they want to see the blood glucose data, which was available through to downloadable blood glucose measurement meters, but they also want to see how much insulin the patient have injected. This was, until today, not possible. So we developed hard and software system where at the end, the physician as well as the patient can see both. They see the glucose levels and they see the corresponding insulin injections. This is a real patient, and on the very left-hand side hand, you can see that there are yellow bars and there are blue bars who indicate the amount of the time of insulin injected. Our software has an algorithm in place, and this algorithm can also show if the patient has interswitched his insulin pens. So if there is an error in injecting insulin. And this is an example where we see that, that mistake, the patient and the physician have reacted, and now he's doing a very good job. This works as a heart. The portal that you've seen is the heart. One thing, of course, you need the data. The data come on the one hand via our blood glucose meter, which sends the data, the blood glucose levels, time and date, wirelessly and fully automatically to this portal. So the patient has to do nothing. No cable to inject, to plug in, no button to press, no software to install, no app, nothing. Fully automatically. In addition to that, we have developed smart insulin pens. These smart insulin pens are worldwide unique due to two things. One thing is these insulin pens can use every insulin that's on the market. So you don't have to need one insulin from a special insulin producer. You can use all insulins that are available on the market today. This is one thing. On the other hand, and this is absolutely critical for the system, this insulin pen also transfers the data fully automatically. First time wireless transfer of insulin data. So the patient injects insulin as he did before, measures blood glucose as he did before, and the data is automatically in the portal where the physician can see that. So you see on the right-hand side, on the right side, the physician, but also the relatives can see the data, the mother of a child or the children who wants to see the data from his parent. In addition to that, we have also developed a Bluetooth insulin pen for people who see their smartphone as the center of the data management, and the smart insulin pen then transfers the data to an app, and with this app we can also link not only to our own blood glucose meter, but we're also able to link these data or to download data from third-party hardware. So we're absolutely open because at the end of the day we only want to see the data. I want to give you the results of the trial that we did together with the German health insurer. What we did, we got a lot of patients together, type 1s and type 2s, nearly 220 patients. They are already using insulin, but they're on a bad shape. Their so-called HbA1c, which is the mean glucose level, is much too high. So much too high means in this sentence 8.7%. You should be about 7%, so it's absolutely too high. And what we did, we developed our system, give that to the patient and the physician, and then the physician was able to see the data and react and to adjust therapy. And then we see that the HbA1c goes down, and after 1 year, another bettering in the glucose levels. So we really show in a trial it works. In addition to that, we are able to see that there is no higher risk of hypoglycemia. So although they go down with the blood glucose levels, they don't go too down to get a hypoglycemia. This is for safety reasons absolutely interesting. I like to show you one case. I hope you can see that there are the insulin levels are going up and down. There's a high variability, a lot of reds in the spreadsheet. And after 3 months using our system, the patient was in better shape. He has less variability. The glucose levels are in lower range. So this is not a study, it's a real patient. It's a real patient who benefit from our system, together, of course, with the physician. Where are we today? We have CE conformity for the hardware as well as for the software. So our software is a medical device. We have data and IT security regarding ISO 27001, which means that we absolutely take care of the patient's data. We have proven the medical effect, a benefit that I've shown you a few seconds before, and we have this acceptance. Patients as well as physicians use this system. And in Germany, we got reimbursement for the system. So every health insurer in Germany reimburses our system. Every patient who uses insulin is able to get that. And this was a huge step that we achieved half a year ago. We are currently getting the first market access in Germany with the sales reps. And what we are doing today to get more market access, we are, of course, looking for cooperation partners with strategic companies. We want to drive our EU market approach since we got EU CE mark. And then, of course, we're looking above the ocean to go, on the one hand, to the US market, where we need FDA approval. On the other hand, and this is something where we talk about a little later, to Canada, where it's not so hard to get approval once you have CE mark. So as a conclusion, we offer better monitoring between the visits. We offer better glucose control with less risk of getting those secondary complications like blindness or kidney disease or heart attack. And though we got the patients more quality of life. And at the end of the day, we also show that we can save money. This number, 4,500 euros, are the costs when the patients get into the hospital because he has a hypoglycemia and was unconscious. So this is something that we really can save. No one of our patients in this trial had to go into the hospital due to hypoglycemia. So we also show benefit on a medical side, but also on an economical scale. So this is what we are currently doing today. I'm very happy that the colleagues from Toronto are here, where insulin was developed in the 1920s, and this is something that would not be possible when insulin was not developed today. So thank you for your patience.
Thank you, Christian. We will take now questions directly. If you have a direct question to the presentation, and the same is for Toronto. Tony, I would like you to give me a signal if there are questions from Toronto.
Yes, are there any questions so far to the presentation? Yes, we have a question from Dr. John Ross, please.
If you wouldn't mind moving to the podium so we can see you. I don't see if that's too far, but that would be nice. Thank you.
Good morning. Thank you very much. I just wanted to make more of a comment than anything else. I think this is an incredibly important disease process which we don't appreciate, I don't think, in the general public. This is a huge burden of disease that is coming our way, and I think this particular solution, as part of many other solutions to trying to manage this, it sounds excellent, and I just would like to applaud your work so far. So I hope that this has success, but I think we absolutely have this just a disaster coming our way. We really do need to manage diabetes.
Thank you.
Thank you. There's time for more questions if there are.
I don't see any. I see one more hand. Just 1 second, please.
Hi, this is Ivy Wong from Women's College Hospital. I just had a question about the patient population that you're able to look after with your software. Does it also include patients who are pre-insulin pump, or does it only really work with the insulin pens connected?
Yeah, thank you for that question. We are only focusing on people that are using insulin pens, so that are on MDI. We do not target people that are currently on an insulin pump. So this is something that is a different patient type. But we are also targeting people that want to use our system instead of a pump. So we are a real alternative to an insulin pump.
Thank you.
Okay, I don't see any more hands here, so over to you, Alex.
Okay, any more questions here? I would have a question. One I'm going to take later to the podium, but one direct. On one slide you said, and then it's also the relatives who can see, how it works and how much insulin would need and so on. And I think of youngsters who might not want to always, or like an elderly couple, and the husband anyway sort of getting into the whole business and his wife taking control. How do you deal with these human factors of your advice?
There are two things. One thing is when you take a child, then there are the areas where the patient, where the parents want to see the data, and the child is okay with that. Then when they're older, they don't want the parent to see the data, but then they also don't want to write this manual diary. So then they use our system for a documentation, but don't let the patient, the parents see the data. And then there comes the time where they say, okay, I want to invite my physician and my nurse to see the data. So different areas, different ages, and everybody finds some benefit for himself.
All right. Thank you very much.
Thank you.
Christian, we will see you back on the podium in just 20 minutes.